There was someone who promised to ask you a question.
As we look for that person,
The
will it be
gentleman is
arrogant or ignorant?
Ignorant.
Ignorant.
Okay, start it off. Has this study been done anywhere? Okay. Yeah,
There is any such.
yes. Yeah,
Yes,
this
we actually have
comparative study.
documents from doctors where they have actually started to use laser treatment in the eradication of tumors and cervix. I can also send, we don't actually have the document as hand, we have it in PDF form if you would like to see it. And then we also have them in the eradication of lymphomas, which is a skin cancer for children, where laser treatment is being used. So that just means that laser treatment in cancer as a new modality being used. Its implementation is still very slow, but it is still in Kenya, but it is not used as much.
Yeah, tell us briefly about photon therapy and proton therapy.
So photon therapy and proton therapy still have the same concept as laser therapy, where they still have one photon being used, which has the same wavelength and can be generated into one beam. But more research is still to be done about it, because we have heard about proton therapy and photon therapy this year alone. And the documents from the website, from Wikipedia, from American Cancer Society have not been very exclusive about them. Proton therapy, they have actually been started to be investigated this year, where I'm still talking about new developments. Because if you talk about laser therapy, it has actually, I think the first original documents which we have found about them was from 2012, and then in the next 3 years they were not there, and then 2015 where we found so many more documents about them, and in 2016, BBC was able to go to a hospital in UK where they've actually found that laser therapy is being used, and you can find that video on YouTube.
Cost comparison.
Pardon?
We did the cost comparison, treatment, the various treatments of cancer. How much will it cost for?
Actually, chemotherapy is a very available sort of cancer method because it is cheaper compared to the others. Hormone therapy is not mainly used because, let me give you an example of hormone therapy. It's mainly used after breast cancer. Can I elaborate more on it? Let's say when women ovulate, we produce hormones, right? So hormone therapy is mainly used to stop these hormones because these hormones also cause the breast of women to also become tender and stuff, and there's going to be possibility of more tumors to be growing. So after surgical oncology has been done, because breast cancer, normally people do not allow for radiotherapy to be used because you completely burn it off. So most of the time, as we got from the nurse from the Kenyatta National Hospital, she told us surgical oncology is mainly used. Let's say if there's cancer in one breast, they chop it off, and then they use hormone therapy. So when you ovulate, they stop those hormones because the hormones make it tender and everything, and then more tumors can grow to the other side. So that's how hormone therapy. So hormone therapy, immune therapy, all those cancer methods depend also the type of cancer. Where chemotherapy is the mostly used right now in Kenya, where those others just depend. Will it continue? Will it not? Is there something, should it be there to stop the hormones from growing like in the breast cancer, so it's to stop more tumors going to the other one? That's how the other cancer treatments are being used.
How much will it cost?
Chemotherapy.
Okay. Those methods that you mentioned.
So I think laser treatment will be expensive at first because it's a new discovery. But then if the scientists want to develop more of them to be readily available, so their cost will decrease. And chemotherapy as of now is very cheap because it's common, but it's not the right treatment because there's so much side effect.
And also chemotherapy, there are different drugs which are used for different sorts of cancer. So I cannot exactly tell you that chemotherapy is exactly this price because it also depends on the type of cancer. If you have breast cancer, of course you're going to use different drugs. If you have esophagus, you're going to have a different drug, and they're not going to vary. They're going to vary in the prices.
Objective, while you're finding the most common types of cancer in our country, Kenya, or you are finding the most common type of cancer in Nairobi? Is it in Kenya or in Nairobi? Because you went to NIH and then you went to Sharba and then to Figure.
Okay.
So the research was for Kenya or for Nairobi?
Okay. So Kenyatta National Hospital being the largest hospital actually in Kenya, majority of the patients from those places, let's say Nakuru, Embu, Eldoret, from those places are actually taken to Kenyatta National Hospital. because in those places radiotherapy is not available. So when they're brought to Kenyatta National Hospital, their records are there. And inside the Kenya mortality death rates actually covers the entire of Kenya, where they also talk about the cancer here and the cancer there. And that document actually shows that the same information which we have here is the same information inside those books, where breast cancer, esophagus cancer, and cervical cancer are on the rise.
What is the relationship between HIV and cancer?
So like when you get HIV and AIDS, there's a high chance of you getting cervical cancer because the infection, like it's a concurrent disease, it's a concurrent illness which brings about cervical cancer.
Let's say something like cervical cancer. Sometimes HIV and AIDS can be passed through sexually transmitted diseases, right? So STDs also have those infections, right? So when those infections pass through the cervix or the prostate, they can cause infection to grow over there, causing the lumps to arise in the cervix. So with the lumps arising in the cervix, there will be infection there, and then the precancerous tumors will actually start to grow. So HIV and AIDS mainly is through the STDs, and with these STDs, they pass the infections to those places of contact.
High blood pressure.
There's a disease called leukemia, because I'll use a child prevalent type of cancer. So leukemia is mainly cancer of the blood, if I can call it that. So when there's high blood pressure, the blood is moving in a very fast rate, with the pulse also being high. When this happens, they can cause cuts in the blood vessels, if I can exactly say that. Inside, because of the high blood pressure, high blood pressure wear and tear will occur. When wear and tear occurs, let's just say there will be a small, tiny cut, if I can say it like that. And with this tiny cut, it will give rise to infections. Because any place which is open, any place of the high blood pressure, there will be a cut, and with this cut, it will be vulnerable to diseases. So when it will be vulnerable, infections can come there, infections will happen, polyps will grow, precancerous cells will start, and after that you find yourself with leukemia as such.
And also here we say that cancer is one which causes high blood pressure and the other way around, because when you have cancer, you have stress and like, a lot of things are going in your head, and then that causes the high blood pressure. And the other way.
Yeah. Yeah. It's true. Yeah. Yeah.
Thank you for your time.
Thank you for your presentation. You clap for them again.